Welcome to This Week Health Conference. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, a set of channels and events dedicated to leveraging the power of community to propel healthcare forward. Today, we have an interview in action from the fall conferences on the West Coast. Here we go.
All right, we are here at the CHIME Fall Forum with another interview in action. My name is Holly Russell. I am the daughter of a CIO that you might know, Phil Russell. And I am here with Bobby Zarr. Bobby, tell us who you are and what you do.
I'm Bobby Zarr, as you said. I could get my name right. I am the Vice President of Healthcare Strategy for uPerform. And uPerform is a just-in-time learning platform that enables learners, specifically in the EHR, to learn while they're working, and also helps them in those critical workflows so that they know what to do when they need to know what they do, instead of in a classroom or having to call a help desk or get somebody else to help them. So it's a great tool to reduce clinician burnout and increase clinician satisfaction.
That's wonderful and extremely needed right now, for sure. I feel like clinician burnout, I mean, it's up there with AI, and it's sometimes.
I understand. We've actually coined a new term. We call it burnover.
Okay.
Instead of burnout. It's that deadly combination of burnout and turnover, because they really go hand in hand. And when you put it in that perspective, it's more than just an emotional reaction that, oh, somebody feels bad, somebody's tired, wants to do something different, or they're overburdened, overloaded. When you call it burnover, it really adds that financial impact, because turnover is a financial impact on an organization. It costs roughly $500,000 to $1 million to replace a physician. Okay, $45,000 to $75,000 to replace a nurse. So when you add those numbers up to it, burnout is a real financial crisis in healthcare right now, compounded with all the other things that they're loaded down with: margin erosion in the marketplace, coming out of a pandemic where, you know, we've lost a lot of the workforce, the changing landscape that we're faced with the payer competition. You may call it payviders, so the payers are now competing for those high margin revenue sources that hospitals used to work for, and then now they're left. They're certainly not attacking the ED or attacking the indigent care. They're going after the high payers, and that's really tough on hospitals. So.
Oh my gosh, yeah, for sure. Well, it's fantastic to hear about what you guys are doing. What are you guys doing specifically here at CHIME? What's going on?
We love CHIME. We love the events. It's a great networking. Of course, number one thing is just reconnecting, making new relationships. We're also hosting a couple of events. I'm actually on a panel with Dr. C.T. Lin from UC Health. He's the CMI there. And also with Terry Coots, who is the CIO of the Guthrie Clinic. Yes. And they've been longtime customers of ours, innovators, help us drive our product forward. But more importantly, they have a lot to say around innovation and the topics we're talking about, AI and burnover, as we say out here. Of course, AI seems to be what everybody wants to talk about, as you said on there. We've got a lot happening in that space. We've got a neat lunch meeting at a neat place called Meritage Tavern, which I'm looking forward to. And then we've got a focus group. And the focus group, we've done a number of them with CHIME, and it's a great way for us to, one, test our messaging, also confirm the needs of the industry, that we are on track with where we're going and what we're doing today. So it's extremely valuable. Rarely do you get a chance to sit down with thought leaders and folks like CIOs and the organization to be able to say, what do you think about this? Here's where we are. How do you think this applies? Right, so it's terrific for us in that regard.
That's awesome. Yeah, and building those relationships and understanding where they're thinking. Right now, the CIOs, I mean, I've had conversations with them. They've got so much going on, not only AI and clinician burnout, but also running the organization and all that other stuff. And so getting that time is so valuable. I'm really excited for you guys. I hope it's a valuable time, which I'm sure it will be.
It is. And like I said, the reconnection, really important. The new connections, that's the other thing that happens in our focus groups is rarely do we keep the same groups in. And, you know, sometimes it's one or two of our clients in there, but for the most part, we like to have new relationships, new thought, new thinking coming in, and it really does help us make sure that we're tapping into what market needs, because if we don't deliver with what the market needs, why are we even here?
Yeah, for sure. Well, in those different perspectives, getting some information from a Terry Coots versus somebody else who's a completely different health system, and knowing how our solution can support a large IDN versus a rural health system, it's a completely different process, and that's so important to hear those different voices and build those relationships. That's all great for uPerform. What about for you? Any fun things that you're going to do? I know CHIME has all sorts of different fun things that we can do.
The travel is so much fun. Of course, my flight was delayed 2 hours in Atlanta because they could, I guess they have staffing issues too, right? We didn't have a crew, so sat on the tarmac for 2 hours and finally got a crew there and got in about 12:30 last night. So I got here last night and got to circle around downstairs, and people were still blowing and going, and saw a lot of old faces, a lot of old friends, and that was a good part about it. So that's really the biggest part. It's just a connection. CHIME does a great job of organizing the events. It's rare that you need to really go outside of the resort to do anything. We go to other conventions, of course, other events, and a lot of times to socialize or to have any entertainment, you got to go outside the event. Here, CHIME does a fantastic job of putting it all together. And so you got one place to go to do it all. I mean, you got the entertainment, you got the relationships, the social events, and then you also have a lot of good information, great information for us. I'm looking myself, heading up our AI efforts and looking for where AI is being applied successfully and where it's not. Just was great name drop here for you. Stopped and saw Helen Waters. She and I maintained a relationship over the years, and talking to her about what Meditech is doing in AI. Just great conversations that you can have just walking through the lobbies here. But that's kind of where I'm focused is. AI has a chance to ameliorate a lot of problems in the industry. It also has a chance to exacerbate them as well.
That's for sure. Exacerbate and just create new ones.
Yeah, and when you talk about burnout or burnover, one of the things that we're learning here is how to streamline change and to make change easier and more effective. That's one of the greatest burdens that we put on our clinicians and caregivers is the pace of change. And we implement change a lot of times and it's not effective, or we didn't get the input from the clinicians. It's not communicated well. They don't understand it well on there, and adding on to their burdens already with the who moved my cheese moment. It's hard. It really is. And trying to see the best practices and what other organizations are doing well, and then where they're struggling.
Yeah, for sure. Well, Bobby, thank you so much for your time, and thank you at uPerform for what you guys are doing for the industry.
Thank you so much.
Thank you.
Another great interview. I want to thank everybody who spent time with us at the conference. I love hearing from people on the front lines. It is phenomenal that you shared your wisdom and experience with the community, and we greatly appreciate it. We also want to thank our channel sponsors who are investing in our mission to develop the next generation of health leaders. They are CDW, Rubrik, Sectra, and Trellix. Thanks for listening. That's all for now.